Hello guys, I hope you all are fine and doing well. So today we'll be discussing about the thyroid tumor. So because nowadays they are very keen for asking some questions from the thyroid nodule and the thyroid carcinoma. So I think that this is the best time when we should discuss about this. Though I have already discussed this in my lectures, still we need to discuss about this. So yeah, let's talk about the thyroid nodule and some important points about that. If any patient who is having a thyroid nodule, okay, the first test you will do is none other than TSH. Okay, you will check the TSH levels, and once you go for the TSH level checkup, if the patient is having the TSH levels are decreased, okay, if the TSH levels are decreased, that means it is more concerning for the malignancy. Okay, malignancy. So therefore we need to follow up this patient with thyroid scintigraphy. Okay, thyroid scintigraphy. That's the first thing which you need to remember. Important point. The second thing is that in case this TSH level is normal or it is elevated, that means it is less concerning. Okay, it is less concerning and it is more of a benign. Therefore you have to follow up this patient with the help of USG. USG, please remember this. Okay, after the TSH levels checkup, if it is decreased, you think about the malignancy, go for the thyroid scintigraphy. If the TSH level is increased or normal, it is less concerning, you will follow up this patient with the ultrasonography. Okay, clear with this? Then let's talk about the thyroid cancer, basically the malignant thyroid nodule. Okay, the malignant thyroid nodule. If you can see it over here, we have this thyroid gland over here, and we have one picture of this very patient who is having a tumor in the thyroid. So how do we basically manage this patient? Management for a patient who is having malignant thyroid nodule. We will not discuss about the different types of thyroid cancer, whether that is papillary thyroid carcinoma, whether that is follicular thyroid carcinoma or medullary thyroid carcinoma, or even the lymphoma. We will not discuss about that. That will be a very big topic for us. We'll just mention some important points which are asked in this October exam. So they are usually asking some questions from the management part. Remember that if there is any patient who is having a suspicious malignant thyroid nodule, the first thing you will do is they will give you the size. Okay, the management depends on the size of this thyroid nodule. If the size is less than 1 centimeter, okay, remember this please. If the size is less than 1 centimeter and there is no lymphatic or lymph node metastasis, okay, no lymph node metastasis, you will go for the lobectomy. You will go for lobectomy, please remember this. Okay, if there's any patient with a suspicious malignant thyroid nodule and the size is more than 1 centimeter and less than 4 centimeter, that is more than 1 centimeter but less than 4 centimeters with no lymph node metastasis, the the treatment of choice is total thyroidectomy. Okay, total thyroidectomy. Lobectomy means you will just involve the partial part of the thyroid gland, like this part. Okay, but the total means you will remove all of the thyroid gland. Okay, all of the thyroid gland. Then if there's any patient who is having more than 4 centimeters of malignant thyroid nodule and or there is metastasis is positive, you will go for the total thyroidectomy. Okay, you'll go for total thyroidectomy. And once you go for the total thyroidectomy, and if there is metastasis, what you will do is that you will go for none other than the radiotherapy. Okay, you will also include radiotherapy. You will also include radiotherapy. Done. This is what you need to know about this thyroid a malignant thyroid nodule. Let me make it more clear to you. Let's basically revise this. Okay, let's basically revise this over here because we don't have enough space over here. Let me just crop it out and we'll just cut it, and then we'll go, I will paste it over here. Okay, let's talk about it again. Any patient who is having less than 1 centimeter of nodule, malignant thyroid nodule, go for the lobectomy. That's a partial thyroidectomy. Once you go for it, and is there any indication for the radiotherapy? The answer is no, because the patient is not having any metastasis. But if the patient's what we say is nodule is more than 1 centimeter but less than 4 centimeter, and there is no lymph node metastasis, and you went for the total thyroidectomy, after that you will think of, if is there any indication for the radiotherapy, is there indication for the radiotherapy. Okay, is there any indication for the radiotherapy? The answer would be yes, if there is involvement of lymph node. If there is involvement of lymph node, you will go for radiotherapy. You will go for radiotherapy. Other than that, you will not consider the radiotherapy. But whenever there is a patient who is having a more than 4 centimeters of thyroid, malignant thyroid nodule, metastasis is positive, you will go for the total thyroidectomy. After that, you will think about the radiotherapy, and you have to consider this radiotherapy in this patient. And that is it for your case of malignant thyroid nodule. Please remember this, and that's it.